course, here is a detailed article on the importance of breastfeeding, spanning approximately 2,000 words. Foyas. The profound importance of breastfeeding, nurturing life, health, and bond. Introduction. Nature's perfect first food. Breastfeeding is far more than just a method of feeding an infant. It is a biological norm, a profound act of nurture, and a powerful public health intervention with lifelong implications. Often described as liquid gold, breast milk is a dynamic, living substance uniquely tailored by a mother's body to meet the exact nutritional and immunological needs of her baby. The decision to breastfeed is a personal one, influenced by a multitude of factors, but the evidence supporting its benefits is overwhelming and universal, endorsed by every major medical and scientific organization in the world, including the World Health Organization, WHO, and the American Academy of Pediatrics, AAP. This comprehensive exploration delves into the multifaceted importance of breastfeeding, examining its unparalleled benefits for the infant, the mother, the family, society, and the planet itself. It is a testament to the incredible synergy between a mother and her child, a relationship that begins in the womb and is beautifully sustained through breastfeeding. Part 1. For the infant, a foundation for lifelong health. The advantages of breastfeeding for the baby are extensive, offering immediate and long-term protection against a vast array of health challenges. A. Optimal nutrition and digestive health. Breast milk is the ideal first food. Its composition is incredibly complex and changes dynamically. Colostrum. The first milk produced after birth, often called the first vaccine, is thick, yellowish, and rich in antibodies, proteins, and white blood cells. It coats the baby's sterile digestive system, providing a powerful layer of protection against pathogens. Mature milk. After a few days, milk production increases. This mature milk is a perfect balance of nutrients. Proteins. Whey and casein proteins in breast milk are easily digestible and gentle on the infant's immature stomach, leading to less fussiness and gas compared to formula. Fats. Essential for brain development, retina formation, and nervous system development. The fats in breast milk are highly absorbable. Carbohydrates. Primarily lactose, which provides energy and helps absorb calcium and iron. Breast milk also contains over 200 unique oligosaccharides, HMOs, that act as prebiotics, feeding beneficial gut bacteria like bifidobacterium, which is crucial for developing a healthy microbiome. This leads to softer stools and a lower incidence of constipation and diarrhea. Vitamins and minerals. The vitamins and minerals in breast milk are highly bioavailable, meaning the baby's body can absorb and use them with remarkable efficiency. B. Powerful immune system, boosting and protection from illness. This is one of the most critical benefits. A baby is born with an immature immune system. Breast milk bridges this gap. Antibodies, immunoglobulins. Especially IJ, which forms a protective layer on the mucous membranes of the baby's intestines, nose and throat, preventing germs from entering the system. White blood cells, live cells that help fight infection. Other immune factors, lysozyme, an enzyme that destroys bacteria, lactoferrin, binds to iron, starving harmful bacteria, and interferon, a potent antiviral agent. This immunological support translates into concrete health outcomes. Breastfed babies have a significantly lower risk of infections, ear infections, otitis media, respiratory tract infections like pneumonia and RSV, urinary tract infections, and dangerous cases of bacterial meningitis. Gastrointestinal infections. Diarrhea and vomiting caused by viruses like rotavirus or bacteria are far less common and less severe. Sudden infant death syndrome, SIDS. Breastfeeding is linked to a 50% reduced risk of SIDS. Allergic diseases, including asthma, atopic dermatitis, eczema, and food allergies. Childhood cancers. Studies show a reduced risk of childhood leukemia and lymphoma. C. Long-term health benefits. The protection offered by breastfeeding extends far beyond infancy and childhood. It programs the child's metabolism and health for life. Breastfed individuals have a lower risk of developing obesity and type 2 diabetes. Breastfeeding promotes healthy weight gain and helps develop the baby's appetite regulation, reducing the risk of obesity later in life by up to 25%. This, in turn, lowers the risk of type 2 diabetes. Cardiovascular disease. It is associated with healthier cholesterol levels and blood pressure in adulthood. Inflammatory bowel disease, IBD. Crohn's disease and ulcerative colitis are less common. Celiac disease. The risk is reduced, especially if breastfeeding is ongoing during the introduction of gluten. D. Cognitive and developmental advantages. Multiple studies have consistently shown a small but significant boost in cognitive development among breastfed children. The fatty acids in breast milk, like DHA and ARA, are crucial for brain development. This association is even stronger in preterm infants, for whom breast milk is considered a medical necessity. The close interaction during breastfeeding, the skin-to-skin contact, the eye contact, the soothing rhythm, also contributes significantly to neurological and emotional development. Part 2. For the mother, healing, health, and bonding. The benefits are profoundly reciprocal. Breastfeeding initiates a powerful physiological process that aids the mother's recovery and protects her long-term health. A. Postpartum recovery and bonding. Uterine involution. The hormone oxytocin, released during breastfeeding, causes the uterus to contract. These contractions help it return to its pre-pregnancy size more quickly and reduce postpartum blood loss, lowering the risk of anemia. Mother-infant bonding. Breastfeeding stimulates the release of prolactin and oxytocin, mothering hormones. These hormones promote feelings of relaxation, calm, and intense love, fostering a deep, secure attachment between mother and baby. This skin-to-skin contact is vital for regulating the baby's temperature, heart rate, and stress levels, and is equally soothing for the mother. B. Long-term health protection for the mother. The physiological process of lactation has a profound impact on a woman's body, reducing her risk of several serious diseases. Cancers. Breastfeeding is one of the most effective natural ways to reduce cancer risk. It lowers the risk of pre- and postmenopausal breast cancer and ovarian cancer. The longer a woman breastfeeds over her lifetime, the greater the protective effect. Type 2. Diabetes. Women who breastfeed have improved glucose metabolism and insulin sensitivity, reducing their risk of developing type 2 diabetes later in life, even if they had gestational diabetes. Cardiovascular disease. It is associated with a lower risk of high blood pressure, high cholesterol, and heart disease. Postpartum depression, PPD. While not a guaranteed prevention, the hormonal effects of breastfeeding can be protective against PPD. However, it's crucial to note that breastfeeding difficulties can be a source of significant stress and may contribute to PPD, highlighting the need for adequate support. C. Practical and economic benefits. R. Convenience. Breast milk is always available at the perfect temperature and requires no preparation, cleaning, or sterilization of bottles. Cost-effective. Formula feeding is expensive, costing thousands of dollars in the first year alone. Breastfeeding saves a significant amount of money for the family. Natural birth control. Exclusive breastfeeding can suppress ovulation, leading to a period of infertility known as the lactational amenorrhea method, LAM. This is not foolproof, but can be effective under specific conditions. Part 3. For society and the planet, a global perspective. The impact of breastfeeding extends beyond the individual family, creating a healthier, more sustainable, and economically stronger society. A. Public health and economic impact. If breastfeeding rates were to increase to recommended levels, the public health savings would be enormous. A healthier population of infants means fewer doctors' visits, prescriptions, and hospitalizations, reduced costs for treating illnesses like asthma, ear infections, and gastrointestinal viruses, a more productive workforce, as parents miss less work to care for sick children, potentially higher IQ levels on a population level, leading to greater long-term productivity and innovation. B. Environmental sustainability. Breastfeeding is the ultimate eco-friendly practice. Zero waste. It produces no packaging, cans, plastic bottles, or Tetra Paks that end up in landfills. Zero pollution. It requires no manufacturing, which consumes energy and water and creates industrial waste and greenhouse gas emissions. Zero transportation. There is no need for fuel-consuming trucks to transport formula from factories to stores to homes. Part 4. Overcoming challenges and the crucial role of support. Despite its natural design, breastfeeding is a learned skill for both mother and baby. It does not always come easily. Common challenges include latch difficulties, perceived low milk supply, sore or cracked nipples, engorgement, mastitis, a breast infection, societal barriers, lack of paid maternity leave, need to return to work, lack of comfortable spaces to pump or nurse in public. Success is highly dependent on support. Support from partners, families, healthcare providers, employers, and governments. Key pillars of support include education. Prenatal breastfeeding education sets realistic expectations. Skilled lactation support. Access to international board-certified lactation consultants, IBCLCs, and knowledgeable nurses immediately after birth is critical. Partner and family support. Practical help and emotional encouragement are invaluable. Actually, workplace support. Adequate paid maternity leave, flexible work schedules, and clean private spaces for pumping and storing milk are essential for sustaining breastfeeding after returning to work. Policy and cultural support. Laws protecting the right to breastfeed in public. The WHO International Code of Marketing of Breast Milk. Substitutes to prevent unethical formula marketing and community acceptance all play a vital role. Conclusion: an investment in our collective future. Breastfeeding is a powerful public health strategy, an environmental imperative, and an economic advantage. But at its heart, it is a profound and intimate human connection. It is a mother's body continuing to sustain the life it created, providing not just food, but also comfort, immunity, and a deep sense of security. While it is important to acknowledge that for a small number of women and families, breastfeeding may not be possible due to medical or personal reasons, and that fed is absolutely best, the goal for society should be to enable, protect, and promote breastfeeding for those who choose it. This requires a collective effort to create a supportive environment where every mother has the information, help, and resources she needs to succeed. Investing in breastfeeding is not just an investment in the health of one baby or one mother. It is an investment in the health of our communities and the sustainability of our planet for generations to come. It is, quite simply, one of the wisest and most rewarding investments we can make.